We have a chance now to speak with one of our members of Congress from South Florida. Representative Debbie Mucarsel-Powell is a Democrat from South Miami-Dade, and there she is.
The Congresswoman has been involved in federal relief planning in many respects, and as you see, she joins us right now via Skype from Miami. Good morning, Congresswoman. Good to have you on with us this morning.
Good morning, Glenn and Michael. I hope you're healthy and doing well.
We'll talk all about relief efforts, both underway and what's to come. But first, the President of the United States has launched a phased 3-point plan to reopen the economy. So many people want to itching to get back to work, rebooting the economy. And then there are all the health experts who are really trying to tamp down expectations that can possibly be soon until there's a lot more testing and possibly a treatment. I'd love for you to weigh in on that, your thoughts on that.
Well, Glenna, look, one thing that I learned when I worked at the College of Health and then at the College of Medicine at FIU is that we have some of the most equipped, experienced public health experts here locally and nationally that have been studying epidemiology for decades now. And what they are telling us is that we cannot prematurely open the economy if we're not prepared. We need to expand testing. Everyone is talking about that. We need to make sure that our healthcare workforce has all the equipment in place that they need. If we see a resurgence in cases, we need to make sure that the infection rate is not more than 1. Right now, the infection rate is 3 to 4 people. So if you have COVID-19, you can pass it on to 3 or 4 people. We need to reduce the rate of infection. So we're not there yet. And there is definitely a high risk involved if we were to prematurely open the economy at this point.
Yeah, Congresswoman, we know that the president said Thursday that reopening the country, reopening the states and cities was really a decision for the governors and that he would support them. And then the next day he sent out all these tweets supporting protesters who want the reopening to happen soon, sent out a tweet saying, liberate Minnesota, liberate Wisconsin, liberate Virginia. Are we getting mixed messages here from the president? Is this just political?
Michael, it's so dangerous to have the President of the United States actually encourage citizens of these different states to go against the laws and the government in their states and the orders that they have provided, both Republicans and also Democratic governors who have been very clear that people need to stay at home. Look, staying at home has worked. We have seen the positive impact of so many Floridians who have made that sacrifice of closing down their businesses, but really following that public health order and advice that if you stay at home, we can really control the spread of this virus. This virus is deadly. We don't have a vaccine at this point. We don't have therapeutics at this point. Scientists across the nation are very busy conducting clinical trials. I am hopeful that maybe we can find therapy sooner rather than later. But at this point, to have the President of the United States make this a political ploy and advise citizens to go against the law and the orders of their governors is extremely dangerous. We need to protect American lives. The safety and the health of our communities is the most important thing that we can do as leaders. And we are not going to be open to business and reopen the economy if we continue to see so many people losing their lives. And Miami-Dade County, if you recall, we are the epicenter of COVID-19 in the state of Florida. We're over 9,000 cases. We have seen close to 200 deaths. And so my advice to my community, and I am very proud of my community because they have been very responsible, is to stay at home and wait until we see that peak and slowly have a plan in place based on science and data so that we can get back to normal.
That science and data coming a lot from testing. Congresswoman, I don't know if you were able to hear the prior interview with General Eifert of the National Guard on the program, but he said something really interesting. He was talking about what they want to do with testing and ramping up in the numbers of tests, but he said that it's the results and the lab capacity that's really the issue, not locally, but around the country. Speak to lab capacity around the country and what Congress is doing, if anything, to find more and ramp up that aspect of it.
So one of the things that we have been discussing and to increase funding for more testing, if you remember, the first package that we passed early March included over $100 billion for research, development, and testing. And I think we're going to need to add to that fund. One of the problems that I've seen is that there has not been really a national coordinated effort to make sure that we have all the reagents that we need for additional testing. I keep hearing Dr. Burke saying that we have Abbott laboratories all over the country ready to test, but that they don't have the equipment. I don't quite understand what the holdup is there. I can tell you that we've seen other countries testing at a much higher rate. At this point, we're testing about 150,000 Americans per day. We need to ramp that up to 500 to 700,000 is what we've been hearing from some of the health experts. So we are thinking of passing. There's a bill right now in the Senate that the Senate Democrats introduced that would include an additional $50 billion for testing. And that's something that I would support and that we're working through right now.
Congresswoman, your district includes the incredibly rich farmlands in South Miami-Dade, where produce for much of the nation is grown. And these farmers and the people who work for them are in serious financial trouble because the markets to buy those restaurants, hotels, they are all closed. And some of the farmers are even plowing crops under that are just, coming, are ripening. But this week, late this week, you announced a huge federal grant to go to those farmers and the ag workers down there. How's that going to work?
Yeah, so I was very happy to see that the USDA heeded my advice. I sent a letter to the secretary in March asking them to provide funding so that the USDA can purchase local produce so that we can provide that local produce to our local food banks. And there's $3 billion that have already been approved. That was announced, as you said, on Thursday. So I am now asking them to expedite that. And I have been in communication with the Agriculture Commissioner, Nikki Fried, who's been working hand in hand with me on this issue. She's been wonderful. And we are also linking local food banks, local nonprofits that are feeding those that have food insecurity with our local farmers. So it's not going to really make them whole. They really have been hurting through this pandemic. And I think we're going to need to add an additional funding line item to help our local farmers. But, it is shameful. And one of the things that this pandemic has done is really lift that veil of how produce and food is manufactured and distributed in this country. We continue to see imports coming from Mexico, and we have our local farmers that have that produce available, and it's not being purchased. So I hope that this will give us an opportunity to really support our local farmers, not just here in Florida, but all over the country. We have seen all those images of the milk that has been dumped because there's nowhere for them to sell, and there are people going hungry. So we can do better than this.
And we, in fact, will be talking to someone from Feeding South Florida later in this program. Congresswoman Debbie Mucarsel-Powell, so good to see you, and thank you for your time today.